This month is Depression Awareness Month, and studies show that rates of depression have increased in recent years. Today, we're joined by Dr. Stevan Lahr with Family and Children's Services to talk about the importance of identifying and treating depression. Thanks for being here.
Thank
Always
you.
good seeing you.
Thank you.
So what's the difference between depression and just being sad?
Sure. So they're very different, but we use those terms interchangeably, so it's easy to get confused, right? Sadness is a normal reaction to some type of stressor. Normally it's a loss, it's temporary, and it causes discomfort, but probably not a whole lot of dysfunction. Where depression or major depressive disorder is a medical condition which has characteristics of a sad mood, but then also affects almost every system in your body. So you loss of concentration, disruption in sleep, inability to enjoy life, and then also appetite, and then causes real dysfunction. So you might not be able to go to school, go to work, or even engage in social activities.
Why is it important to treat depression, identify it,
Sure.
and then treat it?
Sure. So the earlier that we can identify and treat depression, the less dysfunction that you're going to have, and it's going to be easier to treat the earlier that we can get treatment. So it causes, like we say, it can cause disability, cause people to lose their jobs, to not engage in relationships. It's very, very disruptive, and so we want to minimize that.
Are there any ways to prevent it?
Sure. So like all medical conditions, the causes for depression vary. Most of them we cannot control, but there are ways to reduce your risk, just like there's ways to reduce your risk for other medical conditions. So some of the things that you can do is, one, move your body as often as possible, especially if you can do it outside, get that sunlight. Have healthy relationships. Don't isolate yourself, and try to limit or not engage in what we're going to say unhealthy coping skills. So excessive alcohol, illicit substances, engage in more pleasurable activities, hobbies, activities, things like that.
What steps should someone take if they feel like, I don't know if it's depression or if it could be something else, but something just doesn't feel right? What should they do?
So it sounds really simple, but it's really hard, and that's stepping out and asking someone for advice or asking for help, okay? Because you don't know how they're going to respond. You don't really understand what's happening right now. And so, if you have that trusted professional in your life, like a primary care physician, make an appointment, discuss it with them. You also can call COPES, that's Family and Children, it's 918-744-4800. There's a therapist there that can talk to you 24 hours a day, 7 days a week. Or you can also make an appointment at Family and Children's Services or any mental health treating facility in Tulsa. Talk to someone face-to-face, and they'll be able to give you some guidance on that.
Reaching out should be the first step, and perhaps the most important.
For sure.
Because when you're having these strong emotions or feeling like something's not right, it's important to know that it's okay to feel that way. It's okay, but also do something about it. Just like what you said, I love that you said when you're sick and you go to the doctor, this is the same exact thing.
Exact same thing, and it's really important to hear that you're not alone. You're not the first person to experience this, and that there's lots of experts that are going to be able to say, hey, yeah, we've seen this before, and this is the next step we need to take.
And have conversations about it. That too makes it easier for somebody to raise their hand.
Decreases the stigma and increases access to care.
Absolutely. It's always good seeing you, getting your input on all things mental health. Dr. Lahr, thank you. If you are someone that you know is in need of mental health support, we want you to know that there is help available. These are a few organizations, including Family and Children's Services, who are standing by right now ready to offer any support. We'll be right back.